I'm Steve Adubato. This subject is so important to so many. Let's get right into it. We are honored to be joined by Laurie Brewer, who is New Jersey's long-term care ombudsman. Thank you so much for joining us, Laurie.
I'm happy to be here. Thanks for the invitation, Steve.
Let's clarify this, Laurie. Your office has been established by what is called the Older Americans Act, a federal law that established an office to what? Monitor how nursing homes are being managed and regulated by the states?
Actually, we're resident-centered. So the purpose of the Ombudsman's office is to advocate for residents of long-term care by investigating allegations of abuse, neglect, and exploitation. As part of that function, obviously, we have a lot of insight into what's going on in long-term care facilities. We also do a lot of public policy and legislative work to try to improve conditions in long-term care facilities.
So as we do this segment, I want to make sure we put up the phone number and the website for your office for people to report, to share, to find out more. And I actually saw you for the first time, Laurie, on the great NJ Spotlight News. I saw you do a segment there, and they cover this issue on a regular basis. But this is the pressing issue that caused me to want to have you. 8,000 plus people who were in nursing homes died of COVID. There were decisions made by the Murphy administration to send people who were in nursing homes and got COVID back into those nursing homes. In retrospect, for those residents and others there, was that a mistake?
Well, in fact, I was on some of those calls, and what the nursing homes were told was that you needed to cohort residents, meaning you needed to separate them. And if you could not effectively do that, you needed to let the Department of Health know that and not accept people with COVID. So I think that there's a little bit more to the story of just sending people with COVID into long-term care facilities. In fact, there were many long-term care facilities that were seriously confused about what was a pretty straightforward message, which was if you can't handle people with COVID, if you can't separate them, if you don't have the staff necessary to segregate essentially them, then you should not take people with COVID. But one of the things I found throughout this whole entire terrible 2 years is that there's just a lot of confusion in the long-term care space about what the guidance was, about what the expectations were. We found that especially with the issue of visitation. A visitation was completely shut down. And there were situations where it was actually allowed under federal law and under the State Department of Health guidance. But I can't tell you how many long-term care facilities just shut their doors and wouldn't let any family members or anybody in. So again, confusion about the guidelines. It's kind of been the hallmark of our work in the last 2 years.
Let me do this. We're taping in the middle of March. It'll be seen later. So again, there's a lot going on as it relates to nursing homes right now. If I'm not mistaken, there are 45,000 New Jerseyans in nursing homes as we speak, correct?
I actually think the number in nursing homes is lower because the census is down. It has not rebounded.
But here's the question. Because of the COVID experience, because of those 8,000 people in nursing homes dying because of COVID, what, if any specific concrete changes have been made, A, and B, need to be made to protect those who are living in nursing homes in New Jersey?
A lot of changes have been made, but I think there's a lot more that needs to be done.
Specifically, what's been done?
Well, what's been done is every long-term care facility is now required to have 2 months worth of personal protection equipment available, right? That's something that was in short supply at the beginning of the pandemic. Every long-term care facility is required to report in their staffings to the State Department of Health on a daily basis to monitor.
And staffing is too low. There are not enough professionals in nursing homes working right now. That's just a fact. They're just, the staffing is a problem.
It certainly is a fact. And I think that, that is one of the long-term systemic problems that really needs to be looked at. Long-term care is, definitely requiring more people in the direct care space. What are called certified nursing aides are really in short supply. The salaries have been increased. The The state has increased salaries and has actually increased the rates that are paid to long-term care facilities.
One second. I'm sorry for interrupting him, but the state is increasing salaries. But what if a nursing home is a privately owned nursing home? How can the state increase?
No, the state, I should clarify that. The state pays, Medicaid pays more than 60% of the cost of long-term care, okay, in nursing homes. And so they have a lot of leverage around what happens in the long-term care space. The state actually increased Medicaid rates. The state legislature and the governor signed a bill that requires that 90% of all Medicaid funding that goes into nursing homes go toward direct care. And the vast majority of that goes towards salaries. So I would actually say New Jersey, in part because it was hit so hard, has really leaned into some major reforms that other states have not caught up to us with yet. Among them is requiring 90% of the Medicaid funding to go toward direct care. That is very unique. There are only 2 other states that have done that, New York and Massachusetts.
So I want to be clear, the Department of Health regulates nursing homes in New Jersey, correct?
Yes, they do.
Okay. So if the state, in fact, has a mandate for those working in nursing homes to be vaccinated and boosted, when that happens, what will be the impact of those who do not get boosted, who are not vaccinated? Will that not exacerbate the staffing problem?
Well, I think that's kind of been a tough issue all along, right? Because the mandates have made people actually get vaccinated. And there are a number of healthcare facilities who have reported that, in fact, some long-term care chains, that when they required it on their own, they really lost very few employees at the end of the day. I think a lot of the people, and a sad fact is that a lot of the people who are not going to get vaccinated are not going to get vaccinated. Okay. And they're not going to get vaccinated no matter when the deadline is. And I think they've had plenty of warning. And a lot of those people have probably already left and found other jobs. So, I think that there's this balance there. When you lose 8,000 people in the long-term care space, you have residents who lined up.
I mean, when 8,000 died.
When 8,000 who died in this, the state takes this obviously very seriously, thus the mandate, thus the requirement for PPE, thus the requirement that you have an infection control specialist in every long-term care facility. That wasn't required before. A lot of things have changed. And the residents, when the vaccines came along, the residents were the first ones to say, I'll take my vaccine. I want freedom of movement. I want to be able to have my family visit me. It was the staff that were lagging behind.
We've got a few seconds left, and I hope that we've been putting up the website, and we'll do this in post-production, the website and the telephone number for people to call in if they have a question, a concern, an issue, particularly about a loved one. Before I let you go, this is not a New Jersey issue exclusively. This is a national problem and issue as it relates to nursing homes, long-term care facilities. Is this an opportunity for us to change national policy? And what would that be in 30 seconds or less?
Absolutely. In fact, the Biden administration just announced some reforms, but we need staffing ratios. You need minimum staffing ratios. New Jersey has them.
Patients to staff. Patients to staff.
We have that in New Jersey. You need the kind of direct care ratio that we have in New Jersey, where you require that a certain percentage of spending goes toward direct care and not toward profit. You need transparency into the profitability of some of these private equity firms that are buying up nursing homes in the state of New Jersey. Do we need to potentially increase funding down the road? That's a distinct possibility. But you know what, Steve? We really need to know where the public dollars are going.
Laurie, again, we'll have you back to monitor the situation. We're taping this in the spring of 2022. We thank you for the work you're doing, and I'm confident you'll be getting a lot of calls, unfortunately, and people visiting the website because there are a lot of serious challenges. Laurie Brewer, thank you so much.
That's what we're there for, Steve. Thanks.
You got it. Thank you. I'm Steve Adubato. More importantly, Laurie Brewer. We'll be right back.
State of Affairs with Steve Adubato is a production of the Caucus Educational Corporation. Funding has been provided by Fedway Associates, Inc., New Jersey Sharing Network, Johnson & Johnson, Atlantic Health System, the Healthcare Foundation of New Jersey, the North Ward Center, Delta Dental of New Jersey, Valley Bank, and by the New Jersey Education Association. Promotional support provided by ROINJ And by New Jersey Globe.
I was diagnosed with cystic fibrosis when I was 2. It's hard to grow up with CF. But I have an awesome care team at Goriab Children's Hospital, helping me do the things I want to do, like play lacrosse. And now I've been recruited to play in college.
Where you go for pediatric care matters.
Atlantic Health System, because every moment is a moment that matters.